So what we're going to do today is we're going to learn how to do a perineal repair. It's a second-degree repair, or in fact repair of an episiotomy. And I want you to think about the vaginal tissue, or the tissue that you're going to repair, as two triangles. You've got the vaginal mucosa, you've got the outside perineal layer, and you've got a deep side, and that's one side of the triangle. And then you have another triangle on this side, and we're going to try to get those two triangles back together. We use 2-0 Vicryl, and this suture has two needles on it, a round needle, and that's for the deeper stitches, and a cutting needle for the superficial stitches. So when you open it up, there's a small part on this side where it just says tear down, and if you just tear that by itself, you'll see the two needles there. I use a curved suture driver or needle driver for the round, and I use a straight needle driver for the cutting. The really great thing is once you've loaded, if you just pull your needle drivers at the same time together, the suture material will all come out, and then you can just clip in the middle or however much distance you think you're going to need for each of the sutures. So I like to use my fingers just to open up the introitus so I can see the apex, or that corner of the triangle, and I'm just going to take a bite above the apex because that will give me hemostasis. Roll that. And tie. Now, everybody does a repair slightly differently, and you're going to develop your own methods. However, I'm going to give you some basic ideas. I'll have you hold that up a little bit. And so these stitches have to be locking stitches, so we just go across the mucosa, we lock the suture material, and bring it up, and again coming across, I lock the suture material. And most of the bleeding here is mucosal bleeding. When you get down to the introitus, you're going to go on the inside of the hymenal ring once. And then I go on the outside of the hymenal ring. And the reason why I do that, I've been told you get less dyspareunia if you don't put the suture material through the actual hymenal ring itself. And this is where people will do things slightly differently. Some people will take a bite here and just do a sliding slip knot on the outside and tie to it. I'm going to bury this stitch, which means I'm going to take it and come in through the vagina and out through the midline underneath tissue. You can hold that for half a second. And now what I'm going to do is I'm going to do the bulbocavernosus stitch here, so the crown stitch. So I'm going to go up high and grasp muscle. And keep holding it up. And then I'm going to do equally on the other side. So I'm going to start low in, come up towards the top, and that's your deep stitch. So you're now trying to do the second part of our triangle. Now to tie this off, you can use a sliding slip knot, which will therefore have less suture material in the perineum. So the way we're going to do that is I've made a loop, and I have the suture material here. I'm going to grasp the loop and make a second loop, and I'm going to slide that through. And then I'm going to slide the whole needle driver through the rest of it. And as we pull back, you're going to see that that's actually going to make a nice knot, but there's not going to be much suture material there. And we're going to cut that, leaving it a little bit of a length there. Put an Alice forceps on the suture material, and I've just put it above, and that's just to keep that suture material out of the way. Now, if you had not have done the crown stitch with the running, you could have done a separate crown stitch here where you would go up and do the same crown stitch I just did and tie it off. If in fact there's any deep stitching left, or deep structure left, then we want to close that dead space by just taking another single suture, and then you can tie that off. We're not going to need to do that on this one. So now we've done the one side of the triangle, the vaginal, we've done the deep, and so now we need to do the perineal skin. And what we're going to use is the cutting blade on a straight needle driver. And what I need to do is I just need to take a little bite here. And I'm going to do subcutaneous stitches down to the bottom of the perineal skin. And obviously I'm not going to be pushing on this person's bottom like this, but this material is a little harder to get the suture material sliding through compared to a human body and human tissue. Just cut that one nice and short, please. Okay. You just want to hold that there. And what we're going to do now is we're going to just do a continuous subcuticular stitch down across the perineum, right down to the apex, just near the bottom of the cut or tear. And when I get down to the bottom, what I want to do is be able to reverse the suture material so I can come up to the top. So that way I'm going to do that is I'm going to take my needle, I'm going to go into the tissue and come out at the apex of the tear, but still stay below the skin. And this sets me up to now do the subcuticular. And I'm going to load the needle driver halfway to do the subcuticular. I hold the tissue a little bit apart, and I'm just going to go about 1 millimeter underneath the skin. I'm just going to roll my wrist to get that out. And we're going to just roll this all the way back up until we have that suture material together, or the tissue together. Whenever we come out under the skin, we want to go in on the other side at the same plane. So I don't want to be going back and forth, but this material, my next suture, is going to go in where that came out, but on the opposite side. So I'm going to keep going here. And then when you just get near the top, you want to be able to get close to where your knot is. So I'm just going to bring this underneath the skin. It's still staying below the epithelial layer. I'm just going to get it out to the top. And this is where we're going to tie off. I'm just going to tie that there. I'm going to tie 4 knots, and then I'm going to cut that short on the knot. And what should happen with normal tissue is that knot is going to spring inside the perineum, and it's going to bring the perineum nicely together.